I welcome you all for today's presentation, and let us discuss in detail about colibacillosis in chickens, which causes severe economic loss in the poultry industry. I am Dr. Ashok Kumar, working as scientist in the Division of Pathology, Indian Veterinary Research Institute. In this presentation we will discuss various aspects of colibacillosis such as introduction, occurrence, etiology, pathogenesis, epidemiology, various disease outcomes of colibacillosis, gross lesions, diagnosis and control. Avian colibacillosis is an infectious disease of birds in which Escherichia coli is the primary or secondary pathogen. Infections include Ehrlichia, cellulitis, omphalitis, peritonitis, salpingitis, synovitis, septicemia and colligranuloma. The previous school of thought was that E. coli was a secondary pathogen to other predisposing factors such as viral infection, stress, ammonia, etc. Current thought is that avian pathogenic E. coli can also be a primary pathogen. Colibacillosis occurs in all types and age groups of poultry as well as in other birds and many kinds of mammals. Most reported outbreaks in poultry have been in chickens, turkeys, and ducks. Many outbreaks occur in poultry raised under a low standard of sanitation, poor environmental conditions, or after a respiratory or immunosuppressive disease. Infection is more frequent in young than mature birds. Colibacillosis was first described in chickens in 1894. Since then, there have been numerous reports on colibacillosis in poultry, and considerable research on the disease has been completed. Many investigators doubt that E. coli is a primary pathogen. Others are convinced that certain serotypes are primary pathogens, and their opinion seems to prevail. Most investigators agree that E. coli frequently can be isolated from a variety of well-defined syndromes in poultry. The etiologic agent is Escherichia coli. The O, also called as somatic antigen serotypes most commonly associated with disease outbreaks are O1, O2, O35, O36, and O78. The K, also called as capsular antigens most commonly associated with virulence, are K1 and K80. In the intestinal tract of normal poultry, non-pathogenic serotypes far outnumber pathogenic serotypes, with 10% to 15% of intestinal coliforms being potential pathogens. E. coli is present in the intestine of birds and mammals and is disseminated widely in feces. Birds are continuously exposed through contaminated feces, water, dust, and environment. Any time a bird's resistance to disease is impaired, pathogenic or facultative pathogenic strains may infect the bird. Sequestered E. coli in such sites as the intestine, nasal passages, air sacs, or reproductive tract may be a latent source of infection. Certain pathogenic serotypes may have the ability to infect a normal bird. E. coli has been isolated from the eggs of normal hens. Its presence has been attributed to ovarian infection, oviduct infection, and to eggshell contamination followed by penetration. Chicks may hatch with a latent infection. However, active infection will typically only occur if some environmental stress or lesions initiates the disease process. A variety of lesions from which E. coli has been isolated include Ehrlichia, cellulitis, omphalitis, peritonitis, salpingitis, synovitis, septicemia, colligranuloma. Respiratory signs occur and vary in severity. This pathology may be associated with poor environmental conditions such as dusty litter, poor ventilation, high ammonia levels, sudden variation in the barn temperatures, but also with concomitant respiratory infections such as infectious bronchitis virus, Newcastle disease virus, laryngotracheitis virus, mycoplasmas infection, or immunosuppressive etiologies such as infectious bursal disease, chicken anemia virus. In these cases, E. coli is a secondary pathogen and will cause the air saculitis lesions. Air sacs are normally thin, glistening and transparent, but bacterial infection will cause the air sacs to become thickened, number of blood vessels within the air sac walls increases, and exudate will accumulate within the cavity of the air sac. An acute inflammation will be characterized by the presence of mucus exudate which will eventually become fibrinous. Thickened air sacs and caseous exudate in the air sac will be present in more severe and chronic cases. There often is an accompanying adhesive pericarditis, fibrinous parahepatitis and peritonitis, hence a polysericitis. Air saculitis occurs chiefly in 3 to 7 week-old broilers, probably peaking at 5 to 6 weeks. Most serotypes of E. coli, after a septicemia, cause a pericarditis. Opaqueness and thickening of the pericardial sac, and edematous epicardium along with myocarditis typically occurs. Pericarditis can also be caused by other bacteria including Chlamydophila species. E. coli is often isolated in pure culture from organs or the yolk sac of recently hatched birds having depression, septicemia, and variable mortality. With omphalitis, the navel is swollen and inflamed and the bird feels wet. Abnormal yolk material and peritonitis is typically seen on necropsy of birds with an E. coli infection of the yolk sac. A great variety of other organisms such as species of Aerobacter, Proteus, Klebsiella, Pseudomonas, Salmonella, Bacillus, Staphylococcus, enteric Streptococcus, and Clostridia are frequently isolated from yolk sacs of embryos and navels of chicks, most likely as mixed infections. E. coli, Salmonella, and Remarella anatipistifer produce respiratory signs. Air saculitis, pericarditis, parahepatitis, and peritonitis. In outbreaks of Remarella anatipistifer, involvement of the air sacs and a dry, thin transparent covering over visceral organs are present. In coliform septicemia, usually a moist, granular to coagulative exudate of varying thickness is present on abdominal and thoracic viscera and surfaces of air sacs. An acute septicemic disease caused by E. coli resembles fowl typhoid and fowl cholera. Birds are in good flesh and have full crops suggesting acuteness of the disease. This can occur in younger mature birds. There are sudden deaths and variable morbidity and mortality. Parenchymatous organs are swollen with congested pectoral muscles. Livers are green in color and may have small necrotic foci. There may be petechial hemorrhages, pericarditis, or peritonitis. Acute systemic disease may also be caused by various Pastorella, Salmonella, Streptococci, and other organisms. Enteritis caused by E. coli is considered rare, but pathogenic attaching effacing E. coli have been reported. Diarrhea and dehydration are noted on clinical examination. At necropsy there is enteritis, often with excessive fluid in the intestines. E. coli may be isolated from parenchymatous organs. Salpingitis may occur following entry of coliform bacteria from the vagina in laying hens. It is also likely to develop when the left greater abdominal air sac becomes infected by E. coli, causing a chronic salpingitis. Affected birds usually die during first 6 months post-infection and never lay. The oviduct is distended with exudate that may be caseous and has a foul odor. No specific signs are noted, but there may be an upright penguin-like posture. In cologranuloma, signs vary in this uncommon disease of chickens and turkeys. Nodules, granulomas, occur along the intestinal tract and mesentery and in the liver. The spleen is not involved. The lesions resemble those of tuberculosis. Granulomas of the liver have many causes including the anaerobic Generiubacterium and bacteroids. Synovitis and osteoarthritis is a frequent sequel to a systemic infection. Affected birds are lame or recumbent. There is swelling of one or more tendon sheaths or joints. With synovitis, many birds will recover in about 1 week. Osteoarthritis is a more severe and chronic condition where the joint is inflamed and the associated bone has osteomyelitis. These severe chronic infections make birds unwilling or unable to walk. Necropsy findings often include dehydration and emaciation. Synovitis arthritis may also be caused by Reovirus or species of Mycoplasma, Staphylococci, and Salmonella. Apart from above-mentioned disease entities, there are few rare outcomes of colibacillosis. They are panophthalmitis, meningitis, and cellulitis. In panophthalmitis, the birds show hypopyon and/or hyphema causing blindness. Likewise, meningitis is a rare sequelae to E. coli septicemia. And finally, cellulitis is one of the most common causes of condemnation at slaughter in broiler attributed to colibacillosis. Diagnosis of primary colibacillosis is based on the isolation and typing of a coliform into one of the serotypes recognized as pathogens. Diagnosis based merely on the isolation of E. coli is of questionable validity. The possibility of other infections, viruses, bacteria, fungi, chlamydophila, and mycoplasmas should have been eliminated through culture or other means. When E. coli is isolated secondary to some other primary disease, it should be diagnosed as secondary colibacillosis. As far as the control measures are concerned, measures should be taken to minimize eggshell contamination of newly laid hatching eggs. Eggs should be disinfected on the farm prior to storage and should be stored under ideal conditions. Scrupulous hatchery sanitation, disinfection, and/or fumigation procedures should be practiced. A vigorous sanitation program should be followed in raising poultry. Diseases, parasitism, and other stresses on a flock should be minimized as much as possible. Dust should be controlled. Only feeds free of fecal contaminations should be fed to poultry. Pelleted feeds are more likely to be free of contamination. Treatment of water with halogens and related compounds as well as conversion to nipple drinkers has greatly decreased the incidence of septicemic forms of colibacillosis.